Today, we are going to talk about program evaluation. That is the process of determining the value or the worth of a health promotion program. Evaluation is an essential component of public health because it helps us understand whether a program is working, how well it's working, and what improvements need to be made. Without evaluation, we could be investing our resources, time, and effort into programs without ever knowing their impact or how effective they are. There are three primary purposes of program evaluation. First, evaluation helps us determine whether a program achieved its objectives related to improving health outcomes. Did the health of your target population improve after the program? Second, it allows us to improve the implementation of your program by identifying what works well and what doesn't. And then third, evaluation provides accountability to funders, stakeholders, the community, anyone who's invested in this program. In other words, evaluation shows that the program is worth the investment. For example, imagine that you are doing a smoking cessation program designed to help participants quit smoking. Evaluation would help us to assess whether smoking rates decreased among your participants. It could also reveal whether certain elements of your program, such as counseling or nicotine replacement therapy, were more effective than others. Evaluation occurs throughout the entirety of the program, not just at the end. There are two primary categories: formative evaluation and summative evaluation. Formative evaluation focuses on improving the program quality before and during implementation. Formative evaluation is designed to provide real-time feedback that can help guide adjustments to your program. For example, if a community reentry program for formerly incarcerated women discovers that the participation is low, formative evaluation would help identify what are some barriers to women participating in this program. What can we do to guide improvement so that more women will participate in this program? In contrast, summative evaluation occurs after the program is completed. This type of evaluation focuses on determining whether the program achieved its intended outcome. For example, after the reentry program has been operating for a period of time, summative evaluation could help measure long-term outcomes, such as reductions in recidivisms or improvements in mental health. Within summative evaluation, there are three key types: the process, the impact, and the outcome. We have two branches of evaluation. We have our formative evaluation, which is before and during implementation, and then we have our summative, which is after the completion of the program. Within summative evaluation, we have three more types. So we have our process, our impact, and our outcome evaluation. The process evaluation examines what occurred during program implementation. It answers questions such as, was the program implemented as planned? Did participants receive the services that were intended for them to receive? Impact evaluation looks at intermediate changes, so maybe 1 or 2 years after the program has been completed. This could be linked to increases of knowledge, improvements in attitude, or short-term behavior change. And then outcome focuses on long-term health outcomes, such as a reduction in disease rate or improvements in community health indicators. So just to recap, process immediately after the program is completed within the first year. Impact is maybe 1 to 3 years, and then outcome, this is more like 5, 10, 15 years down the road. So for example, let's say we're doing a nutrition education program. We could use impact evaluation to see whether participants improved their understanding of healthy meal planning. So that is part of the immediate observable effects, including learning, behavioral, environmental, and then outcome evaluation to determine whether obesity rates declined 10 years later. Evaluation is one of the most critical parts of a program. In other cases, programs may lack the resources, the expertise, or the time to implement a thorough evaluation. Additionally, confounding factors can make it difficult to know whether the program itself caused the observed outcome. And a confounding factor is an external influence, such as a policy change, economic conditions, this government shutdown, or community offense that may affect results. This means that evaluation can rarely prove cause and effect with absolute certainty. How do you say, oh, 10 years after my program, the obesity rate in the United States has gone down by 2%? Is that because of your program? Or are there other factors that are involved? That's the question that you're trying to answer. Evaluation planning should begin as soon as the program is being developed. This includes identifying goals and measurable objectives, which you have already done in part one of your paper, and collecting baseline data before implementation. And again, you already have this baseline data because in your introduction, you described your target population and you described your health issue. Baseline data creates a reference point so that the changes can be measured accurately. Summative evaluation should also be planned early, even though it occurs at the end. Without planning, programs could discover too late that they didn't collect the data that they needed to demonstrate effectiveness. Who's going to conduct your evaluation? You can have an internal evaluator or an external evaluator. Internal evaluators are people who are already within your organization. They're familiar with the program history, the organizational culture, and the decision-making processes. However, while internal evaluation is typically less expensive, it may introduce bias. External evaluators are brought in from the organization, and these are experts in research and evaluation. They provide a more objective perspective. They're not emotionally attached to the program, and they can bring specialized expertise. However, external evaluation can be costly, and it might require additional effort to ensure communication and clarity. Okay, this is really, really important for your final paper. Study design. Study design is imperative for your final paper. There are several study designs that are commonly used in evaluation, and they aren't just the four that are listed here. We have pre-post tests, experimental designs, and mixed methods approaches. These are the most common. But again, if you want to search for something else, maybe if you want to go to the library and ask a librarian for help, there may be an approach that works better for you and your program. What is a pre-post test? This measures outcomes in the same group before and after the program. Let's say that you took the BMI of a group of 10 people and then you gave them the program, you implemented your program, and a year later you took the BMI of that same group of people. That's a pre-post test. A quasi-experimental design includes a comparison group, but does not randomly assign participants. For example, let's say that you want to implement a nutrition plan within school districts. So you have one school that is getting the intervention, and you have one school that is not getting the intervention. This is not randomly assigned because you're picking two schools. During this quasi-experimental design, you will be comparing health outcomes from the school who got your intervention and compare them to the school that did not get your intervention to see if there's a statistically significant difference in children's health because of your program. An experimental design is the most expensive, but it is also the one with the least amount of bias. It randomly assigns participants to either interventions or control groups. Have you seen Grey's Anatomy? So we have Dr. Meredith Grey and we have Dr. Derek Shepherd, and they are doing an Alzheimer's trial together. Meredith Grey sees that one of her friends who is going to be in the trial is going to be in the control group, so getting the placebo. And so she decides that she's going to switch the placebo with the real medication. That is an example of an experimental design. So there's two groups, the intervention and the control groups, and if it's double blind, which it usually is, the participants aren't going to know if they're getting the real program or not, and also the researchers won't know. if they are getting the real program or not. A mixed methods evaluation combines quantitative and qualitative data to measure outcomes and explore participant experiences. Quantitative data is numbers. So let's say, how many days a week do you exercise? 4. That's quantitative. What's your BMI? Let's say 25. That's a number. What's your height? I'm 5'5". However, qualitative is conversational. It's words, it's how people think, how they feel, how they express emotion. So instead, if you ask me, how healthy do you feel? And I would say, I feel moderately healthy. That isn't something you can quantify on a scale. Or if you ask me, how hard is it to not drink Soda Barn every single day? I would say that is extremely difficult, but it's not quantifiable on a scale. Now, if you ask me on a scale from 1 to 10, how difficult is it to avoid the Soda Barn? And I said 9, that is quantifiable because it has numbers in it. In summary, program evaluation is essential to determine whether or not a public health program is effective, to guide improvement, and to demonstrate accountability. Evaluation should be built into program planning from the very start, and that should include both formative and summative components, and should use appropriate study designs to measure both short-term and long-term outcomes. You won't need to create a massive evaluation study design. Just stick to what is required for your paper. But by understanding and applying evaluation principles, public health professionals, such as you, can help ensure that programs are meaningful, effective, and supportive of improved health outcomes in the communities that they serve. I hope you all have a fantastic week. And if you have any questions, please feel free to email me.